Dr. Aaron Miller, physical therapist here, bringing another episode to you with the foot. This week we're talking about this nice little honker of a tendon right here called your Achilles tendon. And most specifically, we are going to be talking about tendinopathy of that tendon. So just so you guys know, a tendon is a connective tissue that attaches the muscle, your calf, to a bone, your heel, in particular for this tendon. And it's pretty dense, it's pretty thick, but as you guys have heard or may not have heard, recent history, with things like Kobe and Kevin Durant, they had ruptures of their Achilles tendon. But before it gets to that ruptured stage, you can have what's called a tendinopathy. Typically, you may get a diagnosis of tendinitis, and I don't really agree with that terminology because tendons and that connective tissue don't really have a blood supply. And if you look on imaging, and if you can see, sprouting of some vascular or blood supply in that tissue, it actually means that there's damage. It's a bad thing if it's showing blood supply because it displaces the amount of collagen tissue that can be in there. And there's a whole realm of that world that you can really dive into at the cellular level, and Jill Cook does a really good job of describing all her tendon pathology and all that kind of stuff. So, but in our case, the pathology is when this tendon here, it looks like a nice connective strong tissue, but as it starts to get irritation and damage, it can actually kind of look like that. So a nice donut hole. And you may not even know that it's irritated or having a problem, but there's breakdown there. And one of the major reasons that it can break down that I've seen in a patient population and treatment is lack of mobility. So if this guy can't move, more stress goes on the tendon to perform that movement, especially when you're talking about jumping, running, sprinting, plyometric work, and even if it's a quick motion. With Kobe, it was just that quick plant and turn and boom, popped. So there's a cool video of Kevin Durant's where you can actually see the calf just contract and release, and it's pretty wild to see because his was just a back step and it was gone. So it happens. You can have trauma, but there also is this underlying issue that of a repeated micro trauma to the tendon where it's just degenerating, and then it gets really reactive and really painful. And this is the previous step to it rupturing. So how do we identify if it is truly our Achilles? Because there's a lot of other structures in and around this wonderful foot that we can look at. And the first is, yes, do you have mobility? Not just actively like I'm doing, but actually someone testing how the joint is moving in the heel and in this joint right here called your pterygoid joint. If those are lacking, then it's going to put that stress there. So first and foremost, I think you have to have full joint mobility. So make sure we're looking at that or someone's doing that, because you can have pain that's on the inside here and you might think that's my Achilles, or it can be on the opposite side, or it can be underneath. But that's not really Achilles tendinopathy. Well, how you define it is if your pain is right on that tendon. It has to be pinpoint on that tendon. And that's a real indicator that something is going on there. If you don't have that, then you probably don't have a tendinopathy of that tendon. So, and that goes for any tendon in the foot, and lower quarter. And Jill even says, Dr. Cook says up in the shoulders too. So the treatment for that needs to be graded. It's based on load. Tendons actually like load. So even if you have a degenerative tendon, you still have to load it. But it's up to your therapist and professional practitioner to determine what that load is. And the treatment style that Jill uses, and I think it works great in the clinic, is an isometric. In the past, they thought that eccentric or slowly lowering contraction was actually better, but it actually puts more load than you would do with an isometric hold. So you have to find what that hold pattern is and build up. And you do that with 45-second holds, 2-minute rest of doing anything else, and then 5 rounds of that. If you start there, each hold should get better and better and better. Maybe you'll be a little more weight. And even if you can't tolerate 45 seconds, you have to start somewhere. So this is kind of my treatment for Achilles tendinopathy. It works for all tendons as well. So try it if you think you have it. But again, if your point tenderness is not on that tendon, it's probably not it. And you should probably have someone look and see if there's something else going on with the joint or the nerve or something else in that area that could be another differential diagnosis for you. So in the coming weeks, I'm going to talk about running. I have a cool blog coming out about that and some video as well as breakdown of running. So I really hope you enjoy that. As we get nicer weather, more people are going to get out. And I think now's the time to really preface some running stuff as we get into marathon season. So hopefully you guys enjoy. Stay tuned for more, and I'll get back to you. Thanks.